Good day, dear colleagues. Good Wednesday. I'm happy here. I'm happy to see you here in our webinar today that will be about vision therapy in kids with amblyopia. As we know, amblyopia is not rare disease in kids and pediatric ophthalmology, and we know that it is very important to restore kids' vision in childhood so that when they will become adults, they will have no problems with their acuity and vision and binocular functions too. So today, Professor Igor Aznauryan, head of Crystal Vision Eye Clinics and Doctor of Science professor, he will talk about different approaches to restore kids' vision with amblyopia, about different devices that we use in our clinic, in Crystal Vision Eye Clinic in Bahrain for restore kids' vision, about diagnostic approaches that we use for understanding that we really can help to these kids, because for our understanding, if a patient, if a kid have no organic pathology, there are no problems in 10, even 15 years, 20 even years to restore his vision and to give him 90, 100% visual acuity. So if you will have questions, please, you can write them in chat or in questions, and we will for sure answer them after our webinar. Now I'm giving a word to Professor Igor Aznauryan.
Hello, dear colleagues and respected and cherished friends. Today, we are going to discuss in detail the various ways to effectively treat amblyopia, also known as lazy eye, by utilizing the latest and most advanced modern medical methods available. How can we make the treatment process as short as possible in duration and more effective in its overall impact and outcomes? We need to consider various factors and strategies to achieve this goal. Vision therapy indeed contributes to this, but vision therapy is a general concept. Specifically, which techniques are we using and how are we achieving success in this matter? Amblyopia is, as is well known, a condition associated with impaired visual perception from the visual cortex. And the reason why the visual cortex does not exactly fully develop is precisely because the signal that should reach the visual cortex from the eyes is not sufficient, that is, it is insufficient, and thus the cause can be anything, starting from tapered-retinal dystrophy, and including congenital myopia, astigmatism, hyperopia, strabismus, optical media disorders, cataracts, and so on. All of this can be a source of amblyopia, which is a condition that affects vision and can lead to permanent vision loss. As I mentioned, there are many causes of amblyopia, which is why it is classified accordingly. This is the most common refractive amblyopia, which is associated with refractive errors and anisometropic conditions such as astigmatism. This means strabismus, where there is relative deprivation. In fact, when the eye deviates, it shuts off, and the signal from it does not reach because at the level of the brain's reticular formation. There is central inhibition of the image that is not motivated for viewing, and thus the signal does not reach the visual cortex, and the visual cortex does not develop. And then there is deprivation amblyopia, also known as obscuration amblyopia, which is associated with the impairment of optical media, where there is a kind of deprivation, a complete closure of the eye, as in the case of cataracts. This is essentially deprivation by a cloudy lens. Deprivation can also be of another order, for example, in cases of ptosis, corneal opacity, and so on, such as like the slide shows the respective frequency ratios of the various causes leading to the condition of amblyopia and their respective impacts in detail. Diagnoses, and as you can see, the most common cause of refractive amblyopia is anisometropia. Anisometropia, also known as unilateral amblyopia, typically occurs when one eye is optically more preferred than the other, and accordingly, the images from the more optically preferred eye become more complementary to the visual cortex, while the images from the less optically preferred eye are inhibited. Because they interfere with good vision, and accordingly amblyopia develops, with short visual cortex connections forming, which are associated with the optically worse eye, and this is how it all happens. Isometropic amblyopia occurs when there is a detailed refractive pathology in both eyes, such as astigmatism or high hyperopia, and amblyopia develops in both eyes because images from both eyes reach the visual cortex. The signal is just not clear enough, not strong enough to develop visual cells. And meridional amblyopia is something that we essentially discovered. It is a type of refractive amblyopia that develops specifically in the presence of astigmatism. This type of amblyopia is very interesting in itself because, in this case, due to different images forming on different fields of the retina, one axis has a clearer image while the other has a less clear image. Amblyopia selectively develops along the meridian that provides the less clear image. In fact, it actually develops usually in the same eye with astigmatism. And we found the answer to the material substrate specifically related to this type of amblyopia. This means that, accordingly, if you stimulate the visual cells through various methods, such as light or electrical impulses, you can observe specific responses and reactions in the visual system and record visually evoked potential. It turns out that therefore precisely along the meridian that is more optically unsuitable. Indeed, a weaker signal comes from there than from the meridian that is stimulated, let's say, by the same stimuli, but is located in a more optically suitable axis. In this case, it means that the amplitude of the P100 peak, that is, from the visual evoked potential, is higher. In other words, we have proven the real existence of such amblyopia, and accordingly, its treatment also occurs in a specific manner, which we will discuss below. And so amblyopia, which is associated with strabismic amblyopia, is essentially the suppression of the image from the deviated eye. Amblyopia is quite common in almost all cases of strabismus if it is not treated early. This type of amblyopia develops especially in congenital strabismus. In congenital strabismus and early acquired strabismus, there is always this type of amblyopia. The diagnosis of amblyopia might seem straightforward, but in reality it is not quite so. The fact is that in addition to traditional optometric methods of examination which are conducted in our practice, we consider it extremely necessary to perform fundoscopy and thoroughly conduct optical coherence tomography, as well as other essential tests, as well as accordingly measure the eyes and conduct all other examinations too. We started performing optical coherence tomography 10 years ago for all patients with amblyopia with visual acuity, corrected visual acuity below 70s. As a result, we found partial and noticeable atrophy of the optic nerve in 15% of the affected children, and thus we make the necessary adjustments. To the treatment prognosis for amblyopia, we inform the parents in a manner that is appropriate, and our expectations are also adjusted accordingly. Visual evoked potentials are a mandatory method of examination, and we study them using both standard patterns and flashes to understand the P100 peak response to object vision rather than to flashes. Because it is clear that the patient can distinguish light and shadow from a flash, he can see, and he may sometimes have normal latency and normal amplitude of the potential. But it is very important for us to understand how functionally reduced the condition of the conducting pathways in the visual cortex is, and thus by performing visual evoked potentials using patterns, checkerboard patterns, if there is no astigmatism, and patterns with a rectangular light profile, as you can see in the lower image, with different angular sizes of these patterns, we identify the presence of functional reduction in the function of the visual cells or conduction disturbances. Well, electroretinography is also important because it allows us to understand the condition of the retina, and visual evoked potentials allow us to understand the condition, as I mentioned, of the P100 peak, which characterizes the response of visual cells, well, as I already mentioned, the role of electrophysiology is hard to overestimate because it allows us to understand how much the ability for object vision is reduced, not to light shadows, not to flashes, but the studies should be conducted with patterns. Such a study is much more complex, but it provides us with more interesting information and accordingly allows us to make predictions. For example, if we have a sharp decrease in the P100 peak in certain meridians, then the stimuli that will be used for treatment in vision therapy will be specifically adjusted for this type of amblyopia. Thus, the treatment will be effective and shorter in duration. Here's the diagnosis of meridional amblyopia. We present rectangular light profile patterns, which are stripes of various angular sizes, and depending on the P100 peak we get, if it is the same in all meridians, then the amblyopia is typical, not meridional. But if we observe significant changes in one meridian relative to another, then we are dealing with meridional amblyopia. Therefore, this meridional amblyopia must be treated in a specific way. Conventional methods for treating illusions or various stimulation techniques will take a very long time and may never cure it. The principle of treating amblyopia is presented here. We believe that we can cure even the most complex case of amblyopia within 1 month if treatment is started in a timely manner. This comprehensive approach to optical interventions is very important. It's not just ordinary occlusion or deprivation. It's not only the correct correction of optical metropia, but also appropriate stimulation, proper diagnosis of the type of amblyopia, and accordingly the correct stimulation, as well as differential diagnosis with the possible presence of partial optic nerve atrophy. Occlusion should be done for at least 8 consecutive hours. Prescribing occlusion for 3 hours, 4 hours, or 6 hours makes no sense. This was proven through extensive, quote, large-scale studies conducted by Professor Grebko from the United States and reported about 4 years ago at a conference of the APOS, American Association for Pediatric Ophthalmology and Strabismus, in which we also participated together with him. And in general, it can be considered proven that occlusion should be performed for 8 hours or more. Under no circumstances should it be less, otherwise it is ineffective. Our amblyopia treatment system, Dove's Care System, is a system for treating major childhood diseases. These include diseases of the tear ducts, conditions related to amblyopia, optical disorders, congenital myopia, astigmatism, and congenital hypermetropia. We address and treat all of this in childhood, ensuring that the child goes to school without glasses and in good health. And strabismus, this is. Here's the system for treating strabismus. Today we will focus on one component of the system, which is the Dove's Care System. This system allows for the effective and rapid treatment of amblyopia. The treatment methods varied, as I mentioned, with different stimuli depending on the type of amblyopia. The patient is specifically presented with selective stimuli to the weaker eye, thereby carefully and precisely stimulating the visual cells in order to effectively activate the visual cells. It is crucial here for the stimulus to be very selective, as this significantly accelerates the treatment speed by orders of magnitude when combined with occlusion. One of the devices used for treating amblyopia, blister, allows for a fairly rapid improvement in visual functions in cases such as isometropic refractive amblyopias, amblyopias associated with strabismus, and strabismus-related amblyopia. It can be quite stunning effective. Well, here's the detailed presentation of this innovative method. Certain bright flashes are generated at a specific, consistent frequency. And all of this is automated in a fully automated manner, in the appropriate mode, ensuring that the patient is well informed and knows exactly what to do, and accordingly undergoes the necessary treatment in this manner. While another method of vision therapy is the so-called light exposure in a monobinocular scope, where the corresponding zones of the retina are illuminated with pulses of the appropriate frequency and color, because this also matters. For example, with hypermetropia, green objects are perceived better and red objects are perceived worse. Conversely, with myopia, green objects are perceived worse than red objects. Therefore, accordingly, those areas in the visual cortex that perceive the channels of visual information corresponding to the color fields also suffer, or, indeed, in fact, timely. Improving the condition of these channels, specifically the color perception channels, is also important, and this depends indeed, actually, accordingly on the type of refraction. Well, here are various contrast methods that allow the activation of receptors, the so-called off-on receptors, and thus improve visual perception. One of the methods of preoptic treatment, as you can see here, we apply checkerboard patterns, similar to those used in visual evoked potential studies. Here, exclusively, the off-on receptors are stimulated, meaning the perception of light and darkness, but not object perception. In fact, this way you can stimulate the beginning and end of the perception lines of this channel. The beginning, that is. In addition, motion channels, the beginning and end of motion, are also important channels for transmitting visual information. In fact, the patient needs to find the defect right here and align it with this circle. This is, sometimes quite difficult to do in a leopard eye. After a while, the patient begins to quickly distinguish, and in parallel with this, visual acuity increases. There is a very interesting correlation between these things. The top image shows color patterns again, which allow us to improve not only the on-off black and white perception, but also color perception. Transcutaneous stimulation of the optic nerve causes so-called phosphenes, such as flashes of light. These phosphenes that take place in the optic nerve at a certain current strength in the human visual system. And for deep amblyopia, a very effective method, as it allows for the stimulation of visual cells with a gradual reduction in current strength, and therefore the perception of phosphenes will indicate that our treatment is heading in the right direction. And naturally, an increase in visual acuity in this context will also indicate this. Very effective, meaning the electrophoresis treatments we use for the treatment of myopia are generally associated with partial atrophies or some parallel pathologies of the fundus, which can also be significant, or when we want to improve visual perception from the retinal cells. The use of various sets of drugs aimed at significantly increasing the sensitivity of visual cells can be beneficial in terms of forming a more powerful impulse. This impulse will be sent to the brain and stimulate the visual cells in the cortex, thereby enhancing our treatment processes and effectively. The same can be said about the magnet, a variable magnetic field that improves conductivity along the visual axis of the nerve and increases the strength of the visual impulse, which is also important for the corresponding cells that are in a state of partial inhibition. Our invention is a binocular optometric complex that significantly increases the speed of vision recovery for amblyopias, such as abstractive or deprivation amblyopia, strabismic amblyopia, and especially for refractive amblyopia, particularly meridional amblyopia and astigmatism, while the speed of recovery from amblyopia increases by about 10 times when using this device. First, we identify the areas that are specifically affected, the channels that are directly impacted and precisely in the specific patient. And then we appropriately stimulate these channels with the corresponding stimuli. Well, here are the results in order to show the findings. Liquid crystal glasses are also our invention. These glasses are actually called glasses. This is a device that includes an advanced microprocessor, which is programmed using the highly sophisticated software we developed. This software allows us to very individually program this device through this microchip that's inside. Well, in addition to that, there is also the possibility to correct amblyopia as well, and thus you wear the glasses, where the corresponding eye is closed and opened with different frequencies, amplitudes, and variations depending on what we want to achieve, what type of amblyopia we have, and which eye we want to treat.
Seven years ago, escalating glasses developed by Igor Aznauryan, a breakthrough in rehabilitating patients with congenital strabismus. The glasses enable the restoration of sensory fusion or bifoveal fusion in children who developed strabismus at an early age or had it congenitally from birth, allowing them to regain proper vision. We all know that this function is very difficult to restore, and according to Tamara Pavlovna Kashchenko, sensory fusion can only be restored in 24% of children after surgery. The percentage of sensory fusion recovery in these glasses is over 80%. The glasses are liquid crystal lenses that are individually programmed with a special program on a personal computer. This enables the user to set a specific blinking frequency based on the child's parameters, depending on their setting movements, residual strabismus angle, and visual acuity. The child can wear them at home while drawing, reading, writing. This is convenient because it allows for prolonged exposure to the child's visual system, thereby increasing the possibility of restoring binocular functions, which is very important for the rehabilitation of children with strabismus. The glasses are extremely fascinating and do not cause any discomfort to children. They are enjoyable, and the frames can be either of a beautiful mint color or blue, adding a touch of style to any outfit. Therefore, they can be changed depending on the child's mood. This allows to establish a rapport with the child and make sure that he wears these glasses with pleasure. They do not interfere with his normal life. Moreover, the glasses have a special attachment. This allows the child to walk in both optical correction and oscillating glasses. In other words, he has both maximum optical correction, which allows him to see well, and therapeutic oscillating glasses that restore binocular functions.
Well, here is presented the effectiveness of using these glasses in a detailed manner. In treatment with these glasses, it is very effective because it is not just a regular occlusion. It allows us to periodically activate the paired eye for a short period, thereby enhancing and potentiating the effect of the occlusion. Well, yes, amblyopia, it can be treated, and the techniques we use for treatment, these technologies allow for the treatment of not only children, but also teenagers aged 15, 16. The oldest patient whose vision we managed to improve was 32 years old. His initial vision was corrected to 0.4, and we improved it to 0.8. Later, we performed surgery to eliminate his ametropia, removed his glasses, and he happily walked around without them. It's not possible to treat all types of amblyopia at such an age, but at 2 years old, I mean, in certain cases it becomes possible. But in children, we treat almost all types of amblyopia very, very effectively. Thank you very much, friends, for your attention. I hope that what we shared with you today was useful. Thank you very much.
Thank you, Professor Igor Aznauryan, for your talk. If there are some questions about their webinar, you can write them in chat. We will be happy to answer them. And we will be happy to share all our knowledge with you, our dear colleagues. If someone of you want to come and see these vision therapy rooms in our clinic, we will be happy to see you. You can connect with me, and we will meet you in our clinic in Bahrain, and show you everything that we do, all our devices, all our approaches. From the end of September, from the end of the August, from 31st of August, Professor Igor Aznauryan will be in Bahrain having consultations. And if you want to meet with him in person also, or have some talk about different approach in pediatric ophthalmology, we will be happy to see you in our clinic. Thank you so much for being with us today in the morning. Have a good day, and we will see each other next Wednesday at 8 a.m. We will talk about nystagm and different types of diagnostics during nystagmus surgery.